Thank you, Senator Marshall. Senator Markey.
Thank you, Mr. Chairman, very much. And thanks to our witnesses, and thanks for focusing upon the critical healthcare issues that are facing our country today. Massachusetts is renowned for its top research institutions and its second-to-none healthcare system. And it creates an ecosystem for innovation and for care. But at the same time, even in Massachusetts, there are 19,000 positions sitting empty in acute care at hospitals. Half of all licensed practical nurse positions at acute care hospitals sit empty. For home care aides, mental health workers, social workers, paramedics, 1 in 3 of those jobs is empty in Massachusetts. So I appreciate the concerns I'm hearing from more rural states, but we have the exact same set of issues. And it's an urgent crisis. Patients are facing long wait times for an annual well visit. Kids are sitting in adult emergency rooms for hours, days, weeks, waiting for mental health treatment in Massachusetts. People trying to get help meet deadly delays in access to opioid use disorder treatment, like methadone medication, and the healthcare system strains under the weight of surges like the COVID pandemic and natural disasters. Meanwhile, our healthcare heroes who get into their careers to help people in their greatest hour of need are facing their own hour of need. The current system is forcing them to make impossible choices when faced with huge caseloads, immense pressure, intense burnout. So advocates and healthcare unions across the country are fighting to make sure we can keep our workers on the job through better pay and safer working conditions. But without enough of these critical workers, healthcare centers are closing their doors, turning people away, happening in Massachusetts, or forcing patients to wait in line for care. So we have to make sure that we care for our healthcare workers. So let me ask you, Dr. Herbert, I'm hearing over and over again that children are waiting for behavioral health services. People are having trouble getting treatment for substance use disorder. For people in rural communities, in western Massachusetts, or in northern New England, obviously these problems are very real. Can you talk about that and what you would recommend as a solution?
Absolutely, and let me begin by saying that I completely agree with you. My comments largely focusing on rural, the underserved areas and rural areas. They're absolutely, and as the chairman in his introductory comments mentioned, there are underserved areas in urban areas as well that are just as acute and problematic. In terms of behavioral health, there's a number of things that we need. The first thing I would say is there is a critical shortage of psychiatrists, but we're never going to train enough psychiatrists to meet the psychiatric needs of underserved areas. I just don't see it happening in the next decade. There are answers, though. For example, nurse practitioners. So we can train more nurse practitioners in psychiatric to be psychiatric nurse practitioners, and we're developing precisely one of those programs right now. So we need the full range of behavioral investments in the full range of behavioral health services, all the way from psychiatry, nurse practitioners, down to, in some states like Maine, there are opportunities for a credential for undergraduates with an undergraduate degree to work in behavioral health. Most states don't have that. We do. I think more states should, so that you can actually, at entry-level mental health positions, behavioral health in nursing homes, in various kinds of community settings, schools, with just a bachelor's degree even. So we need investments across the board.
Yeah, no question. My wife is a psychiatrist, so I appreciate this mental health crisis that we have in our country right now. We have a climate crisis as well, and climate can impact upon a community's healthcare resources. So Dr. Swanee, could you talk about that in Louisiana?
Yeah, unfortunately, because of our geographic location, we're no strangers to hurricanes, and we've dealt them. I grew up in New Orleans, so I've dealt with them for a long time, and we continue to deal with them. It's unfortunately part of our way of life down on the Gulf Coast, and we just look at ways to be resilient and adaptive.
And how difficult is it, given the sometimes catastrophic events that you have to deal with.
I think it's quite obvious that, you know, we deal with this, and I will say it brings the community together, and of course, it's difficult, yeah.
Yep, thank you. Thank you, Mr. Chairman.